Hi, I'm Leo Goetstouwers. I'm clinical psychologist, psychotherapist, schema therapist, and system therapist supervisor. And I'm happy to present some of the results on World Schema Therapy Day on my research, a pilot study, on schema therapy with couples in which one or both are having a personality disorder, a multiple baseline case series study with N is 12. But before I proceed in this, I would like to share some of my personal motives why to do this study, followed by the scientific and the clinical relevance of it, leading to two main objectives for this study. But first, why doing this research and why developing this model? As said, I'm also a system therapist, and during the long years I've been working with couples, I got a bit frustrated when a couple would enter my room and I noticed that one or both were having a personality problem that wasn't treated at all or not sufficiently. And that's why I started searching for ways how to help these patients or clients. That's also how I became a schema therapist, because as you know, Jeffrey Young developed schema therapy especially for those with personality problems. And when I started working with Professor Dr. Arnold Arnst, who was working in the same team as I was working, he advised me to connect to Dr. Eckhart Rödiger, who developed a schema therapy model for working with couples. So my research is based on his model, but his model is also modified. More about that later. Clinical relevance. One has to realize, and for me as a system therapist, this is important, that relationship problems and psychopathology influence each other. And personality problems go with a higher risk on quite a lot of things, like psychological, physical, and verbal violence. Or interpersonal conflicts, the feeling not being understood. Or distrust, or divorce or splitting up of relationships, or problems with finances, education, work, or keeping a house one is living on. And last but certainly not least, a negative pedagogical influence on children. The scientific relevance of this research is that there's a lot of research that proves the effectivity of individual and group schema therapy in treating personality problems. But there's no research on the effectivity of schema therapy with couples, and if this can enhance the effectivity of individual schema therapy with patients having personality problems. And there's no research on the effectivity of communication training or Connect Talk, and or if Connect Talk or communication training can add to the effectivity of schema therapy with patients having a personality problem. And why am I so interested in this? Well, you know, as a system therapist or system therapists general, they work a lot with communication training. So I was interested in, do you have to start with communication training and then offer schema therapy, or the other way around? And that's what I try to find out. More about that later. Like I said, I had two objectives. My primary objective being the aim of this pilot study is to obtain an initial impression of the effectiveness of the combined intervention of conjoint schema therapy and individual therapy as a treatment for patients with partner relationship problems and a personality disorder according to DSM-5 criteria. My secondary objective being to examine whether communication training or Connect Talk contributes to the effectiveness of the combined schema therapy treatment. I operationalized effectiveness with the following: having reduced negative thoughts about oneself and one's partner using a visual analog scale. I also used another scale, like the ARE, for measuring greater mutual involvement, or daily coordination with the daily coordination scale, measuring higher levels of daily collaboration. and reduction of personality problem-related symptoms, measuring this with the ADP-4. Then my model, like I said, based on Eckhart Rödiger's Schema Therapy model for couples. I start with 3 weekly individual prep sessions, patient only, followed by 3 weekly conjoint prep sessions, patient and partner, followed by 12 weekly sessions, individual schema therapy, patient only, but for the patient or client in the same week, 12 weekly conjoint sessions, patient and partner, followed by 6 weekly sessions connect talk training, patient and partner, and then 5 monthly booster sessions, patient with or without partner. There are some general principles for doing individual schema therapy combined with couple schema therapy. You as a therapist, you have to be active, leading and positive. You have to have an eye for both, using the principle of multiple partiality, meaning that you don't choose sides. You therefore position yourself preferably between the couple. And you often stand by the chairs and speak in the third person singular, which can be good to do because in this way you put the problem a bit further away from the couple or the patient client, and that might make it easier to look at it, especially if a lot of emotions are involved. You promote joint observation, stimulating the couple to work together. You relabel feelings and behavior. You encourage the couple to act. Now, I will enter into more detail about what I do during the different phases during my research, to start with the individual prep sessions. During the prep sessions, individual, I explain my model that is a combination of coupled schema therapy with individual schema therapy. I put the results of the Young Schema Questionnaire and the Scheme Mode Inventory in a case conceptualization. I show the video still phase experiment and connect this to the case conceptualization. For those who do not know the video still phase experiment, it's made by a professor in developmental psychology who asked a mother and her little child, a baby, to be videoed and first to connect. So what you see is that the little child is connecting with her mother in a very joyful way. She smiles and she's happy and she's reaching out and she's trying to play together. And then the task of the mother is that she turns her back to her child. And you see an immediate reaction of the little child on this behavior. You see she tries to reach out again, trying to get attention from her mother. And if this not happens and it's not successful, she makes shrieking sounds. And if this also doesn't have any effect, she starts crying. And in this moment, the mother turns her face back to the child again, and then again, you see a sudden, immediate reaction. The child, happy with the effect of rebonding, you see she's happy again. I show this video because I think it's a strong illustration of what can happen in someone's life if there is no bond. I also explain during the prep sessions individual the mode cycle clash card as designed by Rödiger. Some of you might know his model. He calls it the two-leg mode model. And in this there are two sides, a red side and a blue side. I like this model. You know why? Because it's easier to explain which modes are involved in the interaction a couple can have. And also if it can be easier to explain, but also to recognize the modes they are dealing with. Are you blue or you're red? Are you more on the blue side or more on the red side? That's the way you start speaking with them. And as you can see, the red side is about assertiveness, and the blue side is about attachment. It's a dimensional model. It means that if you are at the extremes of the red side, or if you are at the extremes of the blue side, that's no good. You become unstable. That's why it is called a two-leg model. You need two legs in order to be able to stand firmly. But if you lean too much to the one side, you stand too much on one side on one leg, then you become unstable. If you stand too much at the other side, you stand too much on the other leg, the result is the same. You become unstable. It's all about stability. Dependent, of course, of the situation you are in, the person or persons you have to deal with. Here you see blue, loving connection, willing to trust, other directedness. It's the pro-social side. And the red side is about autonomy, the sense of control, self-centeredness, and the social side at extreme. Basic emotions are also represented in this model: fear, sadness, disgust, or anger. Also the coping modes get a place: submission, withdrawing, dominance. On the blue side, at the extreme, in the form of self-sacrifice, follow and surrender, and at the red side, dominance, overcompensation, fight, and in the middle, withdrawing, passive-active, freeze or flight. And also the critical parent voices, of course, get a place in this model. The critical modes can be about oneself, or they can be about others. And what we are working towards in Schema Therapy, as you all know, is that you try to strengthen the healthy adult, which also can be called the observer self and the contented child. In order to create some more overview, maybe, we also designed this sheet in which the model of Eckhart Rödiger is integrated in how I think that most of you are working with modes and schemes. But this is maybe for later, after World Schema Therapy Day, to look into it, because as I know, the presentations will be available online also after this day. Here I also, during this phase of the therapy, I also explained the mode cycle clash card, which can be a way for a couple to get more grip on their escalations. On the left side, the P1 side, you fill in the trigger moments for the one of the couple members, and at the P1 side, you fill in the trigger moments for the other part of the couple. But here, the coping modes, internal voices, child mode if they are active or not, and neglected core needs, the wishes, and here below the healthy adult solution. I can't go too much into it because I have only 30 minutes, but it helps enormously to get insight into the clashes a couple can have. What do I do during the 3 conjoint prep sessions? Well, partly the same as in the individual prep sessions. I explain to the patient's partner my model and ask the patient to participate in this activity. I again show the video still phase experiment and let the patient explain to his or her partner how things that happened in the past led to schemes and modes as summarized in the case conceptualization. I explained the MCC and asked the couple to complete the MCC with a recent example. And then, what do I do during the 12 individual schema therapy sessions and the 12 conjoint sessions? As said, for the patient client, these sessions are in the same week, meaning that in the individual sessions, you can speak with the client or the patient about all kinds of vulnerable things. Partner is not there, no strange eyes, no feeling necessary that you are being judged at. So you create a lot of safety. But you also address the subjects that are relevant for the partner relationship. So, during the individual sessions, I work with schemes and mode triggers like in regular schema therapy, using the same techniques, but I give special attention to those subjects that are related with the partner relationship problems. During the conjoint sessions, the latest clashes in the relationship are taken as an example to work with, using the MCC, but also I use chair work, like in regular schema therapy. I use the timeout procedure in order to prevent or to stop clashes. I use front stage or backstage. Front stage being that what you see. Backstage is that what is behind it. Or I use red or blue-sided modes, like in Eckert's model. I use also fleas to connect with my patient and the partner. And I also use conjoint imagery rescripting. I position myself between the couple and allow them to look at themselves from a distance as if they are seated at the other side of the room. The couple is represented by putting 2 chairs in the room to look at. The chairs are given the first names of the couple. While we do this, we keep on speaking about them in the third person singular, as if we are a reflecting team looking at 2 patients who happen to be the couple. Me stimulating the couple to take an observer self and an unified detached mode stand. So what do I do during the 6 Connect Talk sessions? Well, during the Connect Talk sessions, I'm therapist and trainer. I teach my patients communication skill techniques to better their mutual communication and connect this to the problems they experience as a couple. I explain the importance of safety to enable an open way of communication, which therefore is a precondition to experience connection with each other. I teach them the timeout procedure, and I start teaching them the ABA method, in which A is the one who sends and B is the one who receives. But there is a task to be fulfilled. If A speaks, B has to listen, which can be quite an experience for some couples who are not able to do this at home. If A speaks and finishes, B has to summarize. If A speaks, B has to endure what A says. And also this can be quite a challenge for some couples, because at home they are used to interrupt each other or to comment on what the other says verbally or non-verbally. Here this is forbidden. So that means that you teach the couple to differentiate, to endure the differences that are always there. And as easy as it sounds, as difficult it can be. Once A finished talking and B summarized well, then the whole thing is reversed. B becomes A and A becomes B. I also use this method for the next step, negotiating about whatever is important in the relationship. And last, also the ABA method for giving feedback, which can be quite difficult for a lot of couples. And therefore it's put on the last row. So here are the results. As said, I'm still working on my article. It has to be published, and I hope it will be in the Journal of Personality Disorders. So I cannot present quantitative results. It first has to be published. But I can present these graphics. And visual inspection, as you can see, leads immediately to that we see quite a big difference between the 2 orders. Here we see the order first schema therapy, then communication training. And it's the patient's self-belief ratings, meaning that the patient rated his or her negative thoughts about him or herself. During the waiting period, during the prep period, during schema therapy, during the communication training or connect talk training, during the booster phase, and during the follow-up period, which is 1 year, no therapy. You see steep slopes, and here you see stabilization. Here you see a different picture. And as here, there's another order, first communication, then schema therapy. You see this reflected also in the reversed order here. But also here, we see during schema therapy, we see a decrease, but not as big as here. We see also a decrease here, which is almost comparable to here. And we see also stabilization. But the overall picture is here we see more progress in comparison to here. Apart from quantitative data, I also inventorized, collected qualitative data. What I did is, after finishing the booster phase, I asked my patient clients and their partners how they look back on the whole therapy and if they could mention any results. And I repeated this at the end of the follow-up period, so after 1 year. And these are a couple of the things they said. We spend more time together. We argue less. Our relationship with the children has improved. We are better at setting boundaries. My husband projects his fear from the war less onto our children. We have become more realistic in our expectations of each other. When we argue, we are better at keeping it under control. Or I understand that some feelings will never go away and that I have to find a way to deal with them. Or it has helped me to realize that I, the patient client, am not the only one who has to learn to deal with the problems we have in our relationship, but my partner have too. People around me have noticed that I am more in touch with myself. Or I now dare to ask for help. Or I understand that relationships are about seeking connection. Or outbursts towards the children have decreased. Or I am less afraid to communicate certain messages. Or I have learned to stay in the here and now. Or my husband expresses his feelings in a more mature way. Or my husband has become less explosive and gentler. Or I have started drinking less to compensate for my negative feelings. Or we have learned to negotiate. Does my model work for all personality problems? Well, before I say something about that, based on the quantitative results of my research, we could see large effects, especially in the schema therapy communication order. So in that first schema therapy, then communication training or connect talk. In general, we see that in the order schema therapy first and then connect talk and communication training, we achieved the best effects, though the effects were not always statistically significant. However, order effects were significant for the patient's self-related beliefs, an important target because the study focused on treatment of personality disorders. And also, the effects generally maintained during 1 year follow-up. So, I think one has also to ask, as a therapist, certain things. Are my clients able to reflect on their own feelings, thoughts, and behavior? If this is totally absent, I don't know if it works. Are they willing to take responsibility for their feelings, thoughts, and behavior? This also, in my opinion, should be till a certain level present. Can they bear differences? Can they differentiate? Or do you think they are able to learn this? But anyway, I think that schema therapy for couples combined with individual schema therapy for patients or clients with personality disorder might be a viable treatment. Communication training or connect talk should be provided after schema therapy, not before, if indicated. Offered after schema therapy, it has additional effects. Offered before schema therapy, it has little effects and might negatively influence the effectiveness of schema therapy. So far, my lecture on schema therapy with couples and one or both having a personality disorder. I can imagine you have questions or that you want to get in touch with me and get answers. And here is the way how to do it. And I'm looking forward to it. Thank you.